The liver is responsible for creating those inflammation signals, but also clearing them away. And if the liver is overburdened, we do not get this clearing out or this cleaning out so the immune system can reset.
Liver detox and autoimmune disease. And I think it would be great to start by understanding a little bit more of the liver first, right? That's going to be great for me also to know more. So you mentioned about overburdened liver, and what is overburdened liver?
That's a great question and a great place to start, because when we think about the liver, having something overburdened means overworked. The liver is a vital, important organ that we all have and we all need. And it's located on the right side of our rib cage, and it's an important part of our body for digestion, but clearing out so many things in our environment. Everything that we breathe, that we eat, that we put on our skin has to be processed through the liver. So the liver is always working 24 hours a day, 7 days a week, and that's its normal job. So what is an overburdened liver? Well, the answer to that is unfortunately due to our modern lives. Many of us, including myself, live in a big city. We have pollution, we have pesticides on our foods. Many of us take some sort of pharmaceutical medication from time to time, if not daily, for another medical condition. And these things have to be processed by the liver. Not to mention foods like caffeine or processed sugar, alcohol. These all have to be passed through the liver. And the liver breaks these down and breaks them into smaller particles that are not harmful to the body. And then everything can be sent out in through our bloodstream and out through our digestive tract or through sweating or breathing. And that way they can safely exit the body. But unfortunately, the liver often has a lot of work to do. And as I mentioned a few moments ago, there are so many things in our daily lives that we overburden the liver with. So sometimes the liver is working harder than it needs to. And unfortunately, that can leave the body far from feeling its best. And a lot of times we don't feel our best, and we're not quite sure if it is the liver, but we know the liver is a vital part to overall health.
Oh, wow. Wow. So then I'm going to ask you, what is the connection of an overburdened liver with inflammation and autoimmune flares? And also, even how would I know my liver is overburdened? Is there any signs that I think the liver, I don't know, I heard once 500 functions the liver has. I wonder, it was like, oh my God.
What are the signs? And you know, that's a great question, because when I work with my patients one-on-one, 95% of the time we are starting with some sort of liver support as part of our treatment protocol. And that was actually part of the reason why I created my 21-day whole body liver detox, is to get the body supported. Now, when a liver is overburdened, the liver can become sluggish. And if you can imagine an assembly line in a factory, everything's moving along. But if that portion of the machine is slowed down, or there's too many things on the conveyor belt, the machine, the factory is not working well. Then things get overburdened and overwhelmed. So this can look like fatigue. This can look like skin issues are very connected to liver. Itchy skin, hives, rashes, eczema, or psoriasis flared up. And some of these are autoimmune conditions like psoriatic arthritis, joint pain. Brain fog and fatigue are perhaps the two most important and most common signs of liver overburden. And every individual is different. Genetically, we are all different. So for some of my patients, when the liver needs some support, it shows up in the joints. For others, it might be the digestive system. For others, it might be energy or skin.
Oh, thank you. Thank you. So you mentioned also about psoriasis, which is also autoimmune, and there is also the rheumatoid or rheumatic psoriasis, which is quite painful also. So can you talk about then the inflammation relationship between inflammation and because autoimmune is all about inflammation.
Yes,
and the overburdened liver. Yeah.
Of course, and that's such an important connection, right? A lot of people don't realize they might have gotten their inflammation levels tested by their healthcare practitioner. Maybe, maybe not. There are two most common types of inflammation tests in the blood work. One is called C-reactive protein, or CRP, and another one is called ESR, or basically it's your red blood cells clotting. It's the timing that the red blood cells need to clot or to thicken up. And these two markers, ESR and CRP, well, are very important in the body for inflammation, and they can often be high with autoimmune disease. But many people don't remember or don't recall with CRP, it's made in the liver. Your liver is responding to inflammation. And if the liver is overburdened or trying to protect us, it creates many of these proteins. CRP is just one of them. Unfortunately, there are others, which we call cytokines, or messenger molecules in the body reacting to inflammation or reacting to our immune system. And sometimes this is where flare-ups start with autoimmunity, is we have the liver overburdened, we have all of the red lights in the body flashing, there's something going on. And unfortunately, if the body is in this overwhelmed state, it cannot attend to the issue in our joints or in our skin or in our digestive system, wherever the autoimmunity is triggered, right? The liver is responsible for creating those inflammation signals, but also clearing them away. And if the liver is overburdened, we do not get this clearing out or this cleaning out, so the immune system can reset.
Oh, wow. Wow. So very important. You already know the liver is very important, even more now. More respect for the liver and its work.
Always. Yes.
Always. So very important. And so the liver, see, I want to just repeat back a little bit to see if I understood well, because for me this is very important. So the liver will be showing, for example, about the CRP, it can be high when we have inflammation. So the liver will be showing inflammation, but also the liver is responsible for clearing the inflammation. And if it's overburned, it will not clear the inflammation. So we will have effects could be like in your case, you're talking about acne, the skin, and other people could be the joints or brain fog or other symptoms or digestive symptoms in general too. Okay. So now we need to know how we're going to detox this liver in a very effective, but also safe way. If you can talk about this.
Yeah. This is what I love. I love speaking about supporting the liver, because it's very important to make a distinction. A liver detox is not the same thing as a cleanse. Many of us have heard about cleansing, juice cleanse, 7-day cleanse. A cleanse is almost like a flush. There are many ways to do it. I personally do not recommend it for many of my patients, unless it's done for a short period of time for certain conditions. But it's a flush. It's eating very little solid food, drinking lots of liquid, and many of us are running to the washroom. That's a cleanse. That's not what I'm suggesting here. What I recommend for a lot of my patients is liver support. So the liver is always doing its own detoxification. There are 2 phases in the liver naturally happening all of the time to clear out all of those things that we are eating, that we are breathing, medication we are taking. These 2 phases of liver detox are always happening, and they require B vitamins, they require antioxidants, they require amino acids, things that are naturally found in protein. These things help the liver do its job naturally. So a liver detox is just supporting those 2 phases of liver detoxification, that natural body process, giving it that extra support so it can function optimally. In addition to that, we'll talk about what that looks like, but in addition to that, I always tell patients, if we're going to support the liver, let's not overburden the liver any more than it has to be. It's already
makes sense.
Yes, it's already overworked. It doesn't take a vacation, but if we can just remove some of the workload on the liver, this would be things like pausing on alcohol or caffeine consumption. This would be reducing or significantly reducing or eliminating processed sugar, any added sugar of any kind, even natural sugars like maple syrup or natural organic cane sugar, we want you to avoid that because it puts a burden, additional burden on the liver. If there are unnecessary supplements or medications, you always work with your healthcare provider to see what can be either reduced in dosage or taken for a paused for a short period of time. And again, this is why working with a practitioner one-on-one is so vital. But this will also help to reduce the burden on the liver so that all of the good that we are adding in has the opportunity to work to its maximum effectiveness.
Yeah, and I think, as you said, to work with individually, very important, because medicine and what is this person, what consuming that is could
Yes.
be burdening the liver. So, and I think a person A and person B is going to be very different,
very different. And it depends on the symptoms that are showing up for that individual, and potentially if there are any autoimmune conditions that they are currently undergoing treatment for. We do not want to, when we think about the immune system, a lot of the immune system is in the gut, in the digestive system, but the liver is very responsible, as I mentioned, for clearing out some of those immune signaling molecules in the body. So we never want to create too strong of an immune boost, and we don't want to suppress the immune system. It's always a balance when we're dealing with autoimmune conditions. So supporting the liver and not causing the body to almost overreact is very important, right? We would never want to create more stress on the body. We're trying to reduce that stress on the liver and the entire body system at that time.
Yeah, so it makes sense. And it seems to me like almost like a little dance, this subtle
Yes.
dance of where is the line of, we want to work with this, but not too much so that we don't have especially in the case of autoimmune, each case, many times, I always feel like can be quite complex, each person and can be different root causes. And this dance, I think, is very important to be supported by a doctor and a medical provider that is not just, don't do on your own. But we're going to talk a little bit about what you can do on your own soon. But
yes,
before we go there, what you can do on your own, because that's also important for our audience here on the summit, is I want to ask you how often or how many times, I don't even know if it's like a year, a month, or a semester. So let me know, should a person do a liver detoxification to reduce the risk of autoimmunity?
That's a wonderful question and a wonderful wellness practice. I think for many of us, I generally recommend 3 to 4 weeks, so a 21 to 28 day detoxification, liver detoxification, and we'll talk more about what that is and simple things that the audience can do. But generally, it includes reducing some of those harmful things that we might be eating or drinking, as well as taking some of those support nutrients for that period of time. So for 3 to 4 weeks, I generally say that's the time to support the liver. That's also the time where some of these autoimmune markers, for some of us, many of these are can be a delayed immune marker, something like an IgG molecule. We call this immunoglobulins. There are various types of them, but an IgG molecule is made in your gut in response to a food, but in other things as well. It takes about 3 weeks for those to reset. So 3 weeks to 4 weeks is a wonderful time to allow your body to hit the reset button and to really see the full effects. And generally, I recommend once a year, if possible, for an overall general health practice. So the audience can think about 3 to 4 weeks every year. Sometimes I'll do spring and fall. Sometimes I'll do every 2 years. It depends. I recently had a baby, so during pregnancy and the nursing, thank you, the postpartum and during pregnancy, detoxification is not recommended. So for example, if someone listening is going through an active medical treatment or is pregnant or nursing, these would be times where we would not recommend an active detoxification program. But for many other people, this would be something I recommend them consider.
Okay, so and that's wonderful. So it's like once a year, for example, it's
Yes.
okay. That time for your liver vacation. It's
Vacation.
vacation to the hard worker, hard
Give it.
working liver, and do a reset. So and that brings us to talk about also what the person can do as we talk about. You have a gift for the audience. Do you want to
Yes.
talk a little bit about the 20-day detox support, or is
Yeah,
that
well, I want to say, with the 21-day whole body detox, I created that. It sort of mapped out what I had gone through many years ago, when I was in my early 20s as a patient, first working with a naturopathic doctor. I had adult acne, I had migraines, but I didn't go for the naturopath for that. I was just dealing with Advil on a regular basis, thinking that was normal. But unfortunately, this blocked and clogged my liver and created more congestion over many years. And then I was dealing with acne. But the 21-day detox that I went through with my naturopathic doctor so many years ago, when I became a naturopath myself, I created something very similar that used food, used supplements, and used lifestyle practices, things like dry skin brushing, sauna, Epsom salt baths, things that would not pill, but that would amplify my detoxification program for my patients, but even for those that I do not work with one-on-one. That was the goal of the 21-day program, was to detoxify your body at home, from the comfort of your home, safely and easily.
Oh, wonderful, wonderful,
Yes, yes.
wonderful.
But I know a lot of people are not always ready to jump into 21 days, which is why we had created a 3-day mini version of the detox, just to sort of get your feet wet, shall we say. And I have a lot of my patients do the 3-day mini version for maybe 6 days. They do it twice, back to back, and it might be about a week's worth. And they start to see feeling a little bit clearer, slightly less bloated. They might be a little bit less fatigued around day 4, 5, or 6 after the initial few days of no coffee or no sugar. We might, start to feel a little bit clearer at the end of that 4, 5, 6 day mark. So I like this opportunity to sample a 21-day detox by easing the body into it.
Yeah, I think a lot of people would love that, to go little by little.
Absolutely. And it's meant to be simple, because remember, if we are adding stress in our life, and if we are doing a detoxification during a stressful time, cortisol, our main stress hormone, is also broken down in the liver, right? So if our body is under a lot of stress, we have a lot of cortisol. That same analogy that I mentioned earlier, the assembly line, we're giving our liver.
I didn't have time to say, but I think this is a great analogy. I really
Isn't
love
it?
that. Yeah.
Because if we have more cortisol now, for the liver to clear, that's more work for the liver to do. So I always recommend, if we are detoxifying, do not choose a stressful time in the year. Choose a time where you don't have as many social commitments, where a little bit more of a relaxed schedule, so your body will accept the detoxification process a little bit easier.
Oh, that's wonderful. And let me confirm, this 3-day is our free gift for the audience. Am I right?
Yes, you are right. We'll be giving that to all the audience members to partake in and hopefully enjoy. Like I said, if it's one time for 3 days, you can repeat it 2, 3, 4 times. And the same idea is there: reducing the burden on the liver and starting to kickstart through food naturally to support your body's own ability to support the liver function.
Oh, wonderful. Thank you so much. So to receive this wonderful gift for Dr. Laura, you just click the link below. Wait for the interview to finish first. We have all your information here below so people can connect more deeply, and also to connect and get the liver detox for 3 days, which is great. Thank you so much for offering to the audience. So we are ending our session, but before we finish, do you have any final word for a person or for people who are suffering with an overburdened liver? And autoimmune disease. Any final word you would like to tell them, to the audience?
I think for those listening, you know, as a practitioner now for almost 10 years, working with so many women and men with various health concerns, many autoimmune conditions, I will say that the liver is a foundation to our wellness. And whether you are dealing with autoimmune, inflammation, pain, brain fog, or maybe there's a not yet diagnosed condition, but we're not sure what's going on in the body, the liver support, gentle liver support, can be a very important first step at supporting your body's ability to reset itself and return back to health.
Oh, thank you so much. And I love gentle support. That's very
That's
important.
key.
Otherwise, it backfire to the liver, right?
That's right. We want to remember the liver is one of the most hardworking organs, and to be gentle will give you actually greater results when it comes to liver detoxification.